Hi, everyone. Good afternoon. It's good to see you all here today. I'm Emily Beauregard. I'm the director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. And it's been a minute since we've had a state and federal policy update webinar for you all. So I'm really glad that we have a lot of folks with us today. We've had well over 200 folks register for this meeting. So we have a lot of good updates for you, information that you can use as you're advocating for your communities. And why don't we go ahead to the next slide? I know this is also back to school week for a lot of folks, so I hope that's going smoothly. My son just started kindergarten and he's loving it, thank goodness. So Thrive Kentucky, if you're not familiar, if you're joining us for the first time, welcome. We work together to advocate for a stronger and more equitable safety net for all Kentuckians. And these are the principles that guide our work. So when we're talking about different policies, these are the principles that we follow in determining how those policies should be developed and designed to make sure that all Kentuckians are thriving. We can go to the next slide. And of course, you'll get all of these slides in a follow-up, so you'll be able to read them when you have a little bit of time on your hands. I know that was a lot of words on a screen. Here are the members of our Thrive Kentucky campaign. If you want to learn more about any of our organizations, these are all hyperlinks. We can go to the next slide. And in addition to today's webinar, we have a few other events happening this year. So next week, we hope that many of you will be joining us in Bowling Green in person for what we call our roadshow. Our roadshow is a longer program than what we're able to do during our webinars. We get a little bit more into the details of each of the areas that we work in related to public assistance programs and basic needs. And we have some advocacy training that goes along with that. So registration is still open. These are also hyperlinks. And we'd love to see you there. Paducah will be next in September, and then Covington will be our final roadshow location. And in between, we will be having a virtual forum with the Cabinet for Health and Family Services leadership. So we hope that you can join us for all or some of these, and please spread the word. We do offer CEUs for all of our events, including today. Why don't we go to the next slide? And that is in large part because of our sponsors who help to support this work. And so the costs that go into us traveling around the state to, providing refreshments and fun swag and the CEUs is all because we have sponsors who support this work. And we really appreciate having that support. And we do this on a rolling basis. So if your organization is interested in sponsoring Thrive, please reach out to Kelly Talby and she can put her contact information in the chat. Why don't we go to the next slide? Just a little bit of housekeeping. We do have a lot of folks joining us today, so please keep your lines muted. We like to use the chat for questions and comments, and we encourage all the questions and comments. It's really helpful for us to hear what's happening in your community, to hear what may be working, may not be working, and then, of course, any questions that you have. We try to get to those as we're going along. We often just stop and answer a question in the chat, or if we don't have time to get to everything, we'll make sure to send that information in the follow-up email. We didn't have any questions submitted during registration, but if you have questions on your mind now or as we're going along, please don't hesitate to put those in the chat. And I mentioned the CEUs already, but those are specifically for community health workers and social workers, and then any professionals who can self-report. So if you do want CEUs for today, you'll need to complete the evaluation that we send out as a follow-up. We want everyone to do that. You don't have to do it only for the CEUs. We want your feedback so that we can continue to improve the education that we're doing here. But if you do need CEUs, you have to take that evaluation. And then I mentioned the follow-up email, which will include the recording, the slides, any links to additional resources that we're sharing today, and that evaluation form. Why don't we go to the next slide? Here's the agenda that we're going to be covering today. As always, we try to cover a lot in 90 minutes. And so we'll go to the next slide and I'll get us started with our federal update, and then just one more slide. All right, so Congress is in recess, and they're in recess for the next 5 weeks, which means it's an opportunity for you to connect with your members and hopefully have a chance to interact with them in district. But here are a few things that you may want to be aware of over recess and as we're preparing for Congress to come back into session later in the year. So the Senate has voted on their version of a continuing resolution. Of course, September 30th is the end of the federal fiscal year. And I feel like every time we have one of these webinars, we're talking about, we're getting close to this new deadline where if, the budget is about to run out and we're going to need either a full budget or a resolution that is going to keep things going. And Congress has been, just sort of every few months putting together a new resolution. And the version that the Senate has just put out has just passed is mostly level funding for the current, budget level funding through December 11th. It varies slightly from what the House has done, but this particular resolution does not include some of the cuts that have been discussed related to public assistance programs or additional funding for defense. So that's good information to know, and I think that's probably the best that we could hope for with a continuing resolution is to have that level funding right now. But because this is a different version than what the House has voted on, it's going to have to go back to the House for consideration when they return in September. So we're not there yet. Something else to know, the Senate Ag Committee failed to advance the Farm Bill due to opposition from Democrats who are advocating for a delayed implementation of SNAP cost shifts to states. And I have a feeling that we're going to get into that further later in the agenda today. And finally, there have been some efforts to pass additional reconciliation bills. I just mentioned funding the war in Iran, passing voting restrictions, and additional cuts to safety net programs. So all of that could be revived ahead of the midterms, but it's going to be more difficult just because it will be a real-time crunch. And some of these issues, we have, members of Congress who aren't particularly interested in running on those issues and having those as distractions as we're getting closer and closer to the election. But as I said, members are home in their districts, so this is a great time to try to connect with them and bring up the issues, the real life stories of Kentuckians who are losing SNAP, Medicaid, marketplace coverage, and all happening before many of the provisions of the Big Beautiful Bill have even gone into effect. I put here two really good trackers that are showing, SNAP enrollment, from month to month in every state, as well as health coverage enrollment, so that we can be monitoring the losses and educating people about that, including our legislators. We can go to the next slide. All right, the midterms are coming. I mentioned the election. It is on November 3rd, and the last day to register is October 5th. So we need your help spreading the word, making sure people know that, we have an election coming up. It's an important one. Senator McConnell's seat is open, and all 6 congressional seats in Kentucky are on the ballot. So it's important for people to get out there and vote, but you have to be registered first, and your registration has to be accurate. You want to have the right address. You want to make sure all your information is correct. So I included a link here to check your current registration. And when you do that, not only can you confirm right address, right voting precinct, but it also includes who your elected officials are, which I think can be really helpful for folks. And then if you need to register, as a new Kentuckian or in a new area or update your registration, there's a separate link and process for that. So it's important to make sure you're using the right one. And also we need to remember that 17-year-olds can register as long as they're going to be 18 by election day. So we want to encourage all of our 17-year-olds who are going to be 18 soon to go ahead and register to vote. And many of them are probably going to need a little bit of help doing that. I also included a link to the Secretary of State's website, which is really informational and has a lot of helpful everything that you see on the right side there is a hyperlink that goes to different information. So if people are looking for something, that's a really good place to send them. We can go to the next slide. And then I wanted to just give you an update on the Medicaid interim final rule. This is something that we've talked about quite a bit. We've been anticipating this since the Big Beautiful Bill passed in 2025. Almost a year later, CMS issued an interim final rule for implementation of the work reporting requirement or community engagement. The public comment period is over, and I want to thank anyone who submitted public comments, filled out the survey that we put out, the comment collector, or just submitted them directly to CMS. That's really, really important because the IFR is very misaligned in a few really critical areas. And the main one is around medical frailty, what that definition is. So, and there are others, but that's the one that gives us the most heartburn and could lead to more coverage losses that really should be preventable for people who are eligible and will remain eligible for Medicaid coverage. So just a few things about the new IFR. It does make compliance harder for enrollees generally because of the paperwork. It weakens some assumed safeguards that we had for people with disabilities, substance use disorders, physical and mental health conditions that Congress had intended to protect in the way that they wrote the Big Beautiful Bills. That's where the misalignment is in the definition of medical frailty. It adds an entirely new requirement that not only do you have to prove that you have a condition, but also that that condition prevents you from working. And while that may sound kind of common sense, how you prove that, who's going to fill out the paperwork, what that paperwork even entails as far as an assessment, all of those things are in question right now and could be just a really big hurdle for some people to overcome. And those administrative burdens are just going to make it more difficult for enrollees, but also for the state to process that paperwork and to make sure that they're able to do all of that accurately and to do it, in a timely way. One other thing to note is that there is a lawsuit. A federal judge declined. So the lawsuit was filed by 25 states, including Kentucky and the District of Columbia. There was a request for an emergency order to stop CMS from requiring this new definition be met. But that was declined by the judge. So we don't have an injunction. Implementation is moving ahead. And the implementation date when all of this begins is January 1st, 2027. But the judge did make clear that states could request another injunction in the future if they were able to prove harm. And so monitoring how this rolls out in various states, and there are states that are starting early, is going to be really, really critical as we try to make sure that no Kentuckian who is eligible for Medicaid loses their coverage. We can go to the next slide. The final thing that I wanted to share is that there is a new public charge rule. There's been a lot of whiplash around this because, of course, the first Trump administration, we had a public charge rule that was changed and made it much more difficult for people who were seeking citizenship to take advantage of public assistance programs that they were eligible for, or members of their family may be eligible for. And then that was revoked and reversed, I should say, by the Biden administration. And now the Trump administration has issued this new public charge rule. And in addition to that chilling effect that it creates, of course, for people who are really concerned about having something that can be used against them in that citizenship process, there's also a lot of discretion being given to the immigration officers who are the ones that are making these determinations. And so we could see a lot of inconsistency in how this is being applied, which is concerning. And, for Kentucky, we have a lot of mixed status families, and what we know happens whenever these kinds of rules are in place is that children, other family members who are already citizens and eligible for these programs and need the programs, for their well-being, are often opting out or the family is opting out simply because they think that it's too risky. So we're very concerned about that. There is a public charge toolkit with some good, helpful information about how to communicate this and work with communities. We can go to the next slide. I think this is my last one, and I'm going to be, just as always, we like to share with you contact information for our federal delegation. So that's here. You can see local numbers since they are right now in district. And I think it's always good to just stay in touch and reach out and talk to them about what's happening in your community, in particular, who's losing some of their benefits right now. So I'm going to be handing it over to Kelly for some interim session updates.
Sure, thank you. Kelly Talby, she, her. I'm the Director of Policy and Strategic Partnerships at KVH. You can go on to the next slide, Brittany. So just a level set reminder for our 2026 calendar at large on the state level. We are here, that little red line. And there is, let's read between those lines though, because that feels like a very big gap and some designated dates when we all know that there's a tremendous amount of work being done. So the devil's in the details, right? Read between those lines. You can go on to the next slide. Our accessibility guide has become an evergreen resource. It was originally tooled as a session-specific type of guide, but especially with capital construction that will be ongoing for several years into the future, and the development of that temporary structure that now is taking over the parking garage. We try to put this for anyone choosing to come to Frankfort on a separate individual meeting day, a committee hearing day, what have you. Because it is the interim, things sometimes change, entrance utilization shifts. So if you use this and your experience is actually different than what it implies, please let me know. We want to continue keeping it as up to date as a utility as possible and something that is truly useful for everyone. You can go on to the next slide. Just a quick reminder, since these are still relatively new in how they've been structured, but the Legislative Research Commission, our legislative branch, has designed some new dashboards and analytics pages that is almost like growing by leaps and bounds by the week in the amount of information that they're pouring into them. And if you have not yet done so, I do encourage you to consider signing up for their newsletters. The Office of Health Data Analytics in particular, it's new and it's kind of become, it's got upcoming events, awareness activities, new data, new reports that have been published both on a state and federal level at times. It's a pretty cool publication, so I encourage you to sign up for it. I'm going to the next slide. So here are some important links in order to stay plugged in and abreast of what our state legislature is up to. The interim calendar changes a lot. During session, it is a House standing committee and a Senate standing committee. During the interim, that is when they become the interim joint committees. So you can only imagine for committee staff, that is probably the bane of their existence, is herding cats and scheduling for everyone traveling from across the state to be able to attend those meetings on our behalf. Those are our elected officials, right? So that is the important link up there to maintain pace on forward, future out meetings and when they plan to be held. And take note, this month, if you're in the Louisville area, if you're planning to go to the state fair at all, this is when the state legislature sends about half of their August meetings to be held at the state fair in Louisville. So stop on by if you're planning to go anyway. The links there for the interim joint committees and the statutory committees. Interim joint, again, this is where the House and Senate during session is split, it's bifurcated, and they come together during the interim. Appropriations and revenue, health services, families and children's, judiciary. There's a tremendous list there. And when you hit the link for the committee that you're interested in, you'll find a tab that says meeting materials. This has become a very nice landing space where you can review PowerPoints, reports that will be presented at committees. Or if you listen to a committee and they're referencing something, you're like, oh, I want to take a look at that infant mortality report that they just presented, or so-and-so's PowerPoint presentation from Ohio that they just presented on. That's where you can go and find those materials. And the same applies here for your statutory committees. Statutory committee examples are like the Medicaid Oversight and Advisory Board that we'll talk a little bit more about in a second, Government Contract Review, your Administrative Regulation Review Subcommittee, which most people lovingly just call Reg Review. But that is a lot of times when you hear from us on implementation and regulations, that is where those committee conversations are being held. And then there's the live stream channel link as well to keep handy. KET and YouTube are the legislative branch's favorites. You can go on to the next slide. Medicaid Oversight and Advisory Board. Um, this is just like an evergreen reminder. Last year was really its maiden voyage back into the limelight, a dedicated legislative space to discuss Medicaid policy. If you'll recall, last year they kind of started off slow and steady, and then the second half of the year there were at least two meetings, the majority of months. The 2025 findings and recommendations that influenced the 2026 session's House Bill 2 were not actually adopted last year. They were adopted in January of this year. And I say that, and I'll come back to that point in a little bit. During the 2026 interim, the MOAB has a set of scheduled meetings. That's on the next slide, as well. You go on to the next slide, Brittany, as well as some subcommittee expectations. So here is the current schedule for MOAB for the rest of the year for now. And here are the three designated sub-level conversations to influence and inform the work of the Medicaid Oversight Advisory Board. The Waiver Waitlist Management Subcommittee, the Healthcare Transparency Dashboard Subcommittee, I have linked there directly, and they have landing pages, and so far have been public format meeting spaces. The non-emergency medical transportation study has taken on more of a work group offline type of style. They no longer have a dedicated landing page. And we'll talk a little bit about some reporting deadlines and why that might be. Public testimony at the MOAB and at the subcommittees is dedicated for 15 minutes at the end of each meeting, 3 minutes per speaker. And we have learned and witnessed now that it is at the discretion of the chair whether or not to go beyond that 15-minute allotted time. For anyone who tunes in regularly or follows KVH's newsletter, you'll know that at the June MOAB meeting this year, I think it was well over an hour. I can't recall exactly how long, but they honored every single individual who signed up to speak during the June MOAB meeting. And there's the link to the MOAB landing page. You can go on to the next slide. So I want to revisit House Bill 2 from the 2026 session was chock full of a tremendous amount. That was the Kentucky Medicaid Reform Act. And you heard from us on everything from copays to self-attestation. There was a lot of advocacy around House Bill 2. Some of the more granular and technical pieces of House Bill 2 that are in effect are based on some of these reporting deadlines that influence MOAB's activities this year. Starting last month, the Cabinet is organizing a report on a quarterly level to the MOAB specific to Medicaid waiver services and utilization rates. And then if you jump down to the second October 1st bullet there is a report due to the Waiver Waitlist Management Subcommittee, and then that report will in turn influence the subcommittee's report to the Legislative Research Commission on December the 1st this year. So there's kind of a trickle-down effect specific to waiver services and utilization rates and some of the reporting of data, and then reporting of findings and recommendations around what to do with that data. The October 1st bullet there, this one is a little unclear to us. One of the Hail Mary additions to House Bill 2 was a $10 million appropriation, $5 million per fiscal year, to Volunteers of America for a community engagement pilot program. I look forward to learning more, and we're trying to be a part of those conversations if anywhere possible. But with all the discussions around Medicaid shortfalls, current and future, Medicaid funding at large. It's really a little unclear to us what that is going to look like at this time. So stay tuned. Pay for the whole seat, sit on the edge, right? The next to last bullet there, December 1, this is Moab's annual deadline to report to the Legislative Research Commission its current evaluation on the Medicaid program at large and any recommendations it does have. But I will remind you that last year, that actual report of recommendations and findings did not occur until January of this year. So there is a little um, leadership flexibility in acknowledging when that deadline actually happens. And then I've got asterisks there on that final one, December the 31st. Again, that NEMT work group is a little more informal in nature, it seems. And this reporting deadline for what the MOAB is to submit to the Legislative Research Commission on NEMT specific findings and recommendations, falls after the final December MOAB meeting. And so it's unclear if it will be influencing the 2026 report of findings and recommendations, if there will be a presentation alongside it, if it's just a report that's submitted and we all just kind of go read it on our own. We don't know yet. You can go to the next slide. So I want to segue here and close out your advocacy long game and underscore some of what Emily shared about this being a midterm election year. Midterm and presidential election cycles are when you see all 100 House members on the ballot, as well as half of Kentucky State Senate races. The Kentucky State Senate rotates. They're on a 4-year election cycle, but they flip-flop. And this year it is all your even numbered districts. So if you live in an even number Senate district, your legislator is on the ballot. Of the 19 Senate seats on the ballot this year, 11 of them are contested in November. Of the 100 House seats on the ballot this year, some had primaries, they closed out. There are 49 contested races on the House seats in November. And don't forget to check out your local races. Similar links to what Emily shared there before. And you wanted the last slide there, Brittany. I want to remind everyone, it is never too early. Now is the time to be designing how to introduce yourself. Some of you all will be living in districts that has a new elected official. So don't wait until November to start thinking about what you want to say to them. In fact, you could go ahead and reach out if you want to. Introduce yourself, be thinking of what to talk about education-wise on who you are, the work you do, what your organization does, and be ready because we have an education heavy lift ahead of us. And so it is never too soon to kind of get those conversations going. Don't let the bystander effect get you and assume that someone else is doing it on your behalf. And so with that, I'm going to hand it over to Dustin Pugel.
Sounds good. Well, hey, everyone. I'm Dustin Pugel. I'm the policy director of the Kentucky Center for Economic Policy. One of the things that has gotten a lot of play and conversation during the interim is our state budget. So the General Assembly passed a budget this past year, and the governor has been implementing this new budget recently. And that implementation has had a lot of buzz and conversation, and we'll get into a lot of that here in just a minute. But just to offer a snapshot of where the legislature ended up, 40% of our state budget goes to education, K through 12 education specifically. That includes the SEEK formula, but a lot of other things as well. Medicaid is the next largest appropriation. It makes up about 19% of our budget. And the rest, criminal justice system, any other kind of appropriation, post-secondary education, and human services they make up a minority of the budget. So really, when we talk about Medicaid in this context, it is a really significant part of what our budget does. If you throw in human services, you're talking about a third of our budget overall. So if we keep moving through the slides, while that may be the mix of things, if we look at what the legislature passed compared to previous years or compared to what the governor recommended, most agencies were cut 7% over the biennium, 4% the first year, 3% the second year. And And if they weren't cut by that much, they were either kind of held steady where they were before, or saw even deeper cuts. Certainly, we saw with K through 12 education a relatively steady investment. With Medicaid and DCBS, we saw cuts that were much deeper than that 7%. That's really significant, especially when you consider that inflation is continuing at a relatively high pace. And so as costs go up, the executive branch has about the same money to be able to cover those costs. If we go to the next slide, I want to zoom in on a couple of things. First of all, I'm going to refer to base cuts. We'll put these slides out later, but just to very quickly say, the base is really, if you look at what the General Assembly offered, and then you subtract out the specific ways the General Assembly said those funds have to be spent, you end up with what's left over, and what's left over is often referred to as the base. The base is basically just what that agency has to cover its normal bills. And if we go on to the next slide, we'll see that, for example, DCBS's base was cut by 13%. Over the biennium. That is a really significant cut. This is one of the agencies that the governor announced some pretty draconian cuts to, was even looking at cutting benefits like KTAP even deeper in order to make up that shortfall. But then sort of the last minute, he found funds like a project for housing at Eastern Kentucky University that was never started, that he pulled funds from instead to sort of shore up DCBS's budget, as well as several other things that are really extraordinary. We don't normally see a governor pull money from other what are called budget units to shore up, human services or any other part of the budget. And he had to do that in large part because there was a 12% cut that agency was facing this year. If we go on to the next slide, Medicaid's very similar. Medicaid, the general fund appropriation for Medicaid at its base level was cut 8.3% the first year and 12% the next. As anyone on this call knows, that means that the actual cut was much larger because those state dollars are used to pull down additional federal dollars. And if we go into the next slide, it kind of shows how that happened, right? So the governor had a lower general fund appropriation initially, but then he included some extra ways of dealing with that the first year, specifically a $350 million transfer from the Insurance Regulatory Trust Fund, which is a fund that insurance companies pay fees into. And then by shifting a payment to the next fiscal year to our managed care organizations, that would have essentially been the equivalent of a $220 million addition to the budget. And the General Assembly, more or less, when you look at what they line itemed, flatlined Medicaid's budget. And so the gap was around $269 million this year. Again, the governor used one-time monies in really extraordinary ways. I think potentially even legally dubious ways to make Medicaid's budget whole. But that hole is actually going to grow next year. And those extra sources of revenue that the governor identified are not likely to be replicated. So we're going to see, I think, a real significant need this upcoming General Assembly in 2027 for opening the budget again to make up that $421 million shortfall in Medicaid. That $421 million shortfall, by the way, is an estimate from late last year, essentially early this year. So as we get closer to the next fiscal year, that number is going to be a moving target, and we'll provide updated numbers as we get them. If we go into the next slide, I want to say a little bit about why this hole all of a sudden. So Kentucky, obviously, we have a state budget, but we pay for that state budget with state revenues. Those revenues are, made up by taxes. These are taxes that you and I pay either through our income or through the goods and services we purchase, or through a number of other means. By far, the two largest sources of revenue here in Kentucky are the sales and use tax and the individual income tax. Now, it used to be that the individual income tax was the clear largest source of funding, but we've been reducing our individual income tax by cutting the rate that you and I pay for that source of revenue. We cut it from 5% down to 3.5%. And while 1.5 percentage points may not seem like a lot in our paycheck, it's a lot when it comes to our state coffers. It's around $2.1 billion less every year than we would have had otherwise to be able to spend on things like Medicaid and DCBS and behavioral health and aging and independent living and higher ed and K through 12 and all those other things that we talked about earlier. So if we go to the next slide, while our individual income tax has dropped, and our spending has stayed low, we have also saved up a decent amount of money in our budget reserve trust fund. Now that peaked there in 2025, but it's about to drop again because we are spending out of that for a lot of one-time projects that frankly are backlogged and very needed in our local communities. And so while there still will be well over $2 billion in that budget reserve trust fund, it's not as much as it used to be, but there is still plenty to be able to shore up specific needs like our Medicaid shortfall in 2028. If we move to the next slide, I just want to say a quick word about how these income tax cuts have affected our revenue overall. Remember, our revenue is that pie, so to speak, that we have to be able to cut up and pay for all of these things that we need, like Medicaid. And that pie has been shrinking over time as we have reduced our income tax. If you adjust for inflation, we've actually had negative revenue over the last several years, and we're anticipated to have negative revenue moving forward, which is not something we've seen consistently since the Great Recession back in 2007 through about 2010. So this is a real concern that we're going to continue to see. And if we go to the next slide, this general trend of reducing the revenue that we have to be able to pay for these things has resulted in a shrinking general fund relative to our broader economy. It's one way of thinking about how much we put toward the public services that many of us use or interact with on a day-to-day basis. If we look at sort of the previous peak in 1990, after we expanded certain taxes to pay for public education during the Kentucky Education Reform Act, our budget made up about 7.3% of the economy. If we look at where we're headed here in fiscal year 2028, this next fiscal year, it's more like 5.3%. So that's over $5 billion less that we have to be able to spend on public goods and services compared to where we were in 1990. Now, I'm not necessarily saying we need to go back to 1990. I'm not sure what the right target is, but it's clear that when it comes to our state coffers compared to the rest of Kentucky, it's shrinking. And so what that's resulted in is a sort of feeding frenzy in a lot of ways, where agencies and affected parties have really been pushing for bigger pieces of a shrinking pie. And if we go to the next slide, I think the lesson for me is that if we continue to do that, my bigger piece of pie might eat into yours because we have less to work with. And so we shouldn't be fighting for necessarily bigger pieces of a pie. We need to be fighting for a bigger pie to make sure that all of the things that we care about, housing, healthcare, education, public safety, and so forth, are made whole. And so with that, I'm going to pause and I'm going to hand it off to, I think, Kimmy.
Sorry, I was still muted. And oops. Okay. All right. Hey, everybody. I'm Kimmy Ishmael with Community Farm Alliance. I'm going to be giving some updates about SNAP, school meals, senior meals, something that I'm sure is on everyone's mind as school is back in session and there's still currently no farm bill. So, next slide. So there's one thing that we do know currently is that hunger is getting worse in Kentucky, especially with kids and seniors. We are third in senior food insecurity, and 1 in 4 of our kids don't have access to nutritional food. So Feeding Kentucky has done a Map the Meal Gap. So that is linked there for you all to kind of dive a little deeper on those numbers. Next slide. Feeding Kentucky, like I said, has done and not only mapped the meal gap, but they did a hunger study that looked at root causes and impacts of food insecurity. And there were some really big standouts there that I'm sure a lot of us have heard or maybe even experienced. Those being that they either were skipping meals, they didn't have enough money on their SNAP card to last them the full month, or they were making really hard decisions about choosing between, having medicine that month or having food. So this is becoming a little bit more common. The numbers are really staggering, which is not good. But and a lot of that also has to do with if they did have more money, they would be able to buy more nutritious foods. So the money that they are getting isn't lasting as long and not being able to buy as much, which is causing also our health to kind of go down, even though Kentucky also ranks really low in health. Next slide. So another thing that Kentucky struggles with is actually our participation in SNAP. We will talk a little bit about the big beautiful bill, HR 1, and those cuts and how much Kentuckians are not using SNAP right now. But even before then, only about 65% of eligible Kentuckians were participating in SNAP. So a lot of people don't think that they are eligible when they really are. So. And we see here that, I mean, for an individual household, you get $174. For a whole household, $370, which I'm a single mom with a kid and just one kid, I can't imagine. So, um, our SNAP participation needs to go up, especially with the bad cuts that are coming with HR 1 and Big Beautiful Bill. Next slide. So, I had mentioned a second ago about Big Beautiful Bill, which I'll kind of call HR 1 going forward, but it it made the biggest SNAP cut and the largest in history, which is going to cut SNAP around $300 billion for the next 10 years. And this is at a time when our grocery prices are going insane, and food insecurity is also getting more and more. So we are seeing that, SNAP participation is going down even when it was already not being participated in enough. So they're losing SNAP benefits because of these cuts around almost 11,000 children in Kentucky since this implementation. Next slide. So with those huge cuts in SNAP, one thing that it has done is push the cost of SNAP onto state budgets. That's going to start in 2028. It has already started putting that burden on administration cost as well. Then the work reporting requirement is getting more restrictive, and 112 counties lost their waiver after this. So those of you who might not know that we used to be able to accept a waiver that's for the work requirement if were looking for a job, you couldn't find a job, because you live in a state where or a county that it takes a really long time to actually get somewhere that, might have a Walmart to work at. We were accepting those waivers and now those are gone. Only a few counties left in Kentucky actually have those waivers. So, and it also ended the Thrifty Food Plan, which would probably cost about each household around $14 a month also. which really helped other people buy healthy foods. So with this huge cut in SNAP with HR 1, the impacts were basically immediate on not only the recipients, but really pushing back on the states as well. So to make up for that. Next slide. Like I was mentioning just before about the work requirements, that's going to be very huge for a place like Kentucky that is very rural. We have Appalachia, and people who have to drive 30 minutes or more to get to a town that has job opportunities. So we have 112 counties that have lost that, and Elliott, Lewis, Martin, Magoffin, and Wolf are the only ones left that are exempt. But then there is implementation of if you miss reporting 3 months within the 3 years, you lose SNAP. Like you are no longer going to be eligible for SNAP. So we all know how hard it is to remember, oh, I got to do this. I'm gonna, I'll get to this, or, accidentally putting in wrong numbers or being confused about that process. If you do that 3 times within 3 years, you are no longer going to have access to SNAP. So these work reporting requirements just are worsening it even more. Next slide. So I had mentioned just a minute ago that, HR 1 is going to be putting those costs back onto the states. And that will come in 2028 to fund like SNAP itself, the food portion, but currently it's putting back onto the states to for administrative costs. And that will put a huge, huge burden on a lot of states. Now, luckily, I say luckily, but it's going off of error rates, and Kentucky's error rate for 2025 was pretty low, so it was at 6%, and that meant that we would not have to allocate funding until 2029 for that. Some other states were not as lucky. But we have funded about $43 million for 2027, and about 58 million for 2028 to administer SNAP. And we will not have to allocate additional benefits cost currently for right now, but that would be coming. Some things to know about what those error rates look like. They are a measurement of too many or too few benefits being distributed. They are not a measurement of fraud. That is a big thing that we want to make clear for everyone, that error rates do not reflect that or poor administration. They will vary from year to year, and the hard thing is the future cost of this could be $0 to $250 million per year. So trying to get a hold on that as a state budget is also going to be very hard. Next slide. So Farm Bill on the federal level is what funds SNAP. And we were supposed to pass a Farm Bill in 2023 and have yet to do so. The Senate last week did their markup version of the Farm Bill, and it did not pass. And our state senator, Mitch McConnell, who sits on the Ag Committee, was not present for the vote, but they would be able to come back after this recess that we talked about to do that. That markup that they put forward did not pass because the Democrats held with saying, we do not want to cut SNAP. And what they proposed was actually more cuts to SNAP deeply within the next few years. And that error rate that we were talking about, that would be they would be raising the amount for that depending on what your error rate is as a state. And then also the proposal fails to delay the 50% cut to federal funding to SNAP admin costs, which is just another huge vital like blow to our state budget. So we want to really, our action item for this is to really voice to our senators and letting them know that we need a legislation passed. It needs to provide relief to farmers, as well as giving relief to those struggling families by expanding SNAP, um, and extending the SNAP cost shift delay to all these states without making those cuts, which we have not been successful at currently, but we are hoping that we can hold out for that and make those changes. Next slide. So with these federal cuts, a lot, I had mentioned we are here in Kentucky, we have a lot of hungry children. We are seeing more cuts to those kids not having meals at school, where usually they would have a guaranteed meal. The with community eligibility provision, CEP, is very highly used in Kentucky. We have 90% of schools in Kentucky that provide a meal, which is through the SNAP or Medicaid enrollment of their students. And we are also seeing hits to WIC, Summer Food Service Program, Summer EBT, and those other options that schools would try to provide or that was being picked up in the summertime. And now it's also getting hit from in during the school year also. Next slide. Thank you. So, in Kentucky, we are trying and have been talking about free school meals for all in Kentucky. There are 13 states currently that have passed something along those lines, and we are hopefully going to maybe be another state coming soon, but that legislation has been talked about and introduced, and hopefully we can get some sort of traction on that. Next slide. I had mentioned summer EBT. School is coming back. They next summer you hopefully that will still be here, but you can if you had that within the last school year, you can apply by August 15th. Though you get around $120 per child, and you are able to use those at farmers markets as well. There's links there that you would be able to use to either apply or see those resources where to spend. And it's for kids on SNAP, but also Medicaid and KTAP benefits as well. Next slide. And seniors in Kentucky are also being hit pretty hard. We already have a very high senior food insecurity percentage here in Kentucky. So we are unfortunately not fully funding senior meals that are currently going on. We have we had asked for about 50, I believe the governor asked for about 58 million through the Department of Aging and Independent Living, and we only allotted 49 million. In July, our governor announced that he would try to put forth another 4 million for it, which isn't obviously going to make up for that around 10 million that was originally needed, but it is funded, but there are still going to be, waiting lists and things like that, unfortunately, without it being fully funded. Next slide. So we had put a lot of links through this portion here, which will be available to you. But if you are looking for some more resources, you can join the Kentucky Food Action Network that we talk about, school feeding, child and adult feeding. We talk about food in schools, or you can really reach out to a SNAP connector. Those people are amazing. Visit the WIC website and but also find a food bank if you need it through Feeding Kentucky's map. And I think I'll pass it on to Sheila.
Thank you very much, Kimmy, and good afternoon. I'm Sheila Schuster, psychologist with the Advocacy Action Network. Next slide, please. Just a reminder that we're talking about a lot of things that we think of as being health related. They also obviously have an impact on people's mental health and increase the risk of not only mental illness, but also falling into addiction. So underemployment, unemployment, housing instability, social isolation, poverty, poor access to healthcare, food insecurity, those are all things we're talking about today. And all of those have an impact not only on physical health and dental health for that matter, but also on mental health and the risk of mental illness, addiction, or even suicidal tendencies. Next, please. So just a reminder, we had a couple of good bills passed this past session, although the budget was insufficient for outpatient mental health, and there were way too few home and community-based waiver slots funded. We were hoping that 583, the school health and mental health services bill, would get passed, and it failed at the last end of the session, but we have been given great hope that we could get it passed in the short session coming up. House Bill 485 revitalized KRS 202A, the involuntary hospitalization, and I will give a shout out Kentucky. The things that we did in that bill raised our rating in the country from a grade of C+ to a grade of A+. So we now are the top ranked state by the Treatment Advocacy Center in what we are doing to try to serve and better serve people with serious or severe mental illness. So a real win, I think, for those people that we all try to help. Next, please. Yes, lots of clapping. Thank you. We're celebrating next Monday with a press conference. Next, yes. Now, the news is not as good on special needs. The waivers in 2024, there were 13,000 people on the waiting list, and we were given 1,925 new placements, which was fantastic. Unfortunately, this year we had 17,000 people on the waiting list, and we only got 405 new waiver slots, which is obviously grossly insufficient. Senator Adams did great work, passed two bills that will address Kentuckians with special needs. Senate Bill 69 establishes a trust fund to help those on the autism spectrum disorder, and Senate Bill 345 creates some Medicaid funding to help people who are deaf and blind. Kelly already mentioned House Bill 2 has some pieces in there about the waiver subcommittee that she's already addressed. Thank you. Next, please. So you probably, unless you haven't been listening to the news or reading any newspaper, you know that there have been some significant threats to Medicaid funded and CHFS funded services. The first came before the fiscal year even began with a letter to the Lee Specialty Clinic in Louisville saying there was a shortfall of $4.5 million and that they needed to terminate services for 1,000 of their 1,500 patients. Now, even though that clinic is located in Louisville, it serves the whole state. It is the only one of its kind. So it is a multi-faceted physical and behavioral health services, as well as dental and OT, PT, and speech for adults with significant intellectual and developmental disabilities. People literally travel from all over the state to come to Louisville for these services. And what they find is that their loved ones with these significant disabilities very often cannot get basic medical care and dental care and so forth without special procedures and being treated by providers who are very familiar with that population. So this was a dire situation. And then almost on top of that, Kentucky Medicaid sent out a letter to nearly all of the Medicaid providers announcing a 4% cut in reimbursements beginning on August 1st or shortly thereafter. This included the physical and behavioral health providers and the facilities, dental providers, therapy providers, and waiver providers, including all of the 1915C waivers. So those are the ones that you're probably most familiar with: acquired brain injury, home and community-based, Michelle P., supports for community living, and Model 2. It did not include provider entities such as the FQHCs, the rural health clinics, CMHCs, or CCBHCs, because they're paid on a cost basis, and it did not affect the RISE, reentry, or child waivers. So we had a lot going on. Next, please. And the advocacy community rose to the challenge. At the Moab meeting that Kelly mentioned in late June, that room of 70 seats were filled with people with their bright yellow Save the Lee Clinic t-shirts, and the overflow rooms, 4 overflow rooms, were filled to the brim. A lot of the consumers themselves were there with their families, and over 20 of them were able to speak to the Moab committee. The very next day, the governor announced that he had found that money to plug the hole, which was great. Since then, the Commonwealth Council on Developmental Disabilities has sent a letter supporting community services that's been signed by hundreds of individuals and organizations and has their stories as well. The provider group worked together and sent a letter to the governor, Senator Stivers, and Speaker Osborne, urging them to delay the 4% cut. Lots and lots of association supporters and providers. The day after it was received, the governor announced, as Dustin mentioned, that he's been able to take advantage of a year-end surplus and no rate cuts are necessary, which is great. However, these are fixes for 1 year only. So I'm telling you all that the advocacy must continue in the 2027 session. Next, please. So the RISE initiative for people with severe mental illness is rolling out. It continues to roll out in new regions, which I've listed there for you. And we have more participants that are being enrolled. We do need more providers to join as providers for RISE. The reentry waiver was rolled out in April after about a 5-year preparation and implementation. And it is now enrolling people. Actually, while they are still enrolled, they're being visited by the MCO representatives. They're being hooked up with their MCO, and they are then connected as soon as they are released from prison or from the DJJ facility. So those are both up and running and doing very well. Next, please. So the child waiver rolled out in January. It also is looking still for more providers, but it's rolling along. This is for children and youth up to age 21 who are high risk for possible institutionalization, and we of course want to avoid that. And then there are several waivers that have been approved and are rolling out without any problems. Next, please. So I want to remind you about the availability of 988. We're past our 3rd year anniversary. And I'm going to shout out again to the community mental health centers in Kentucky. All of those calls are handled locally. We're the only state in the nation that is doing that. And our call time certainly matches the other states. You can also use this line to get information about services. And you can dial 1 for veterans or number 2 for Spanish language. The special line for LGBTQ plus callers has been discontinued by the federal government, but you can still get help from 988 or from the Trevor Project. Next, please. This is a great, great resource. It's put together by all of those organizations that are listed down below, and the providers themselves have to update their availability each week. So you will get up to the minute accurate information regardless of whether you're looking for mental health treatment, substance use disorder, recovery housing, naloxone, and so forth. So it's live. You can sort by county, you can sort by gender and age, type of problem, paying source, and so forth. But it's just a great, great resource. And next, please. So that's the end. I think I finished on time. Sorry to go so quickly, but happy to hand it over to my friend Priscilla Easterling.
Thank you so much, Dr. Schuster. Appreciate you. Hi, everyone. I'm Priscilla Easterling. I'm the Director of Outreach and Enrollment for Kentucky Voices for Health. We're going to be covering some Medicaid and Marketplace updates. Next slide, please. So let's start off with some child renewal updates. Now, can y'all believe it has been a full year since those have restarted and we're already fully back to normal now? So in case you don't remember, our Medicaid renewals were paused during the pandemic, and they were only unpaused for the first time last year, starting July 2025, after a long 5-year pause. And they've been going on systematically for the last year. And now we're officially back to normal and back to the normal sort of cadence for renewals for both the adult and children population. And that's a big asterisk because the adult population renewals are going to change here soon at the end of the year. But for children, they're back to normal. And after this first year of renewals, ultimately, with all of the cases that were processed, folks, and ongoing case activity, because even though renewals were happening, new applications were also happening, and folks who might have lost coverage might have also reapplied. And so at the end of June, we saw that around 81,000 fewer children were enrolled in Medicaid or K-CHIP after that first year of renewals, which is about a 13% decline. Now, I'm going to put a huge asterisk on this because there's some interesting enrollment data that was folded into reports that started the June 2025, May and June 2025, and then for July 2026, that we just wanted to get some more clarification from DMS around why those numbers seem so sharp. In case you've taken a look at them, it looks like 80,000 people suddenly joined Medicaid in July, which doesn't exactly fit some of the trends that we've been seeing. So just a big asterisk, but this is where we're sitting right now, and we'll share some more updates once we hear more. Next slide. We're going to dig a little bit more. So ultimately, while 82,000 is a lot of kids who lost their coverage, it still breaks down to about 8 in 10 who, once they make it through a renewal, they are likely to stay enrolled and still remain eligible for Medicaid. So most kids who did go through that process did stay enrolled in Medicaid. And unfortunately, though, for the kids who did lose their coverage, the number one reason that we're seeing that loss of coverage is because of paperwork. Those kids lost their coverage largely because of red tape, because of a failure to return a form, or that they were not able to complete that process for some reason. They ran into a barrier, they were unable to submit that documentation, whatever that may be. About 3/4 of the kids who lost their coverage is because of paperwork. So we don't know that we do not know that they are no longer eligible for Medicaid, but we know that they lost their coverage because they were unable to complete that paperwork and get it sent back into DMS. And unfortunately, one of the other pieces of that is that a huge concentration, about 2/3 of the kids who lost their coverage are in that school age group, 7 to 18, account for most of those terminations. And so I think a lot of that, we're still encouraging people to understand what those earlier barriers are, who to connect folks to, always reach out to a connector, and any sort of education that we can do along those lines. All right, next slide. So as a continual reminder for everyone, income limits for children are much higher than for adults. And what we think a lot of adults see when they get their mail and they get the notice and they look at the income limits, they assume that because they might not be eligible for Medicaid, they assume that their kids are not, but that is just not the case. For example, I'll always use this example for a household of 4, 2 adults, 2 kids. If the income is at, say, 50,000, the 2 adults in the household would not be eligible for Medicaid, but their kids still would be, and they would be all the way up to 70,000. So if you're not sure, if you do not ever assume that you're ineligible, just fill out the paperwork and let the state make that decision. And kids are granted 12 months of continuous eligibility once they're approved. So once they're approved, they're in the system and they're good for 12 months. Next slide. So as always, if you're ever working with clients and they get a notice and they're not sure what to do, number one thing that you can do is tell them to reach out to a connector to help walk them through that process. They can get a connector by calling the Connect hotline. They can make updates to their account through the Connect hotline as well, or reach out to a connector and they can make all of those changes for them. And we also have a helpful explainer that is linked there as well. Next slide. Okay, and if you know folks who have lost coverage, again, number one thing, connect them to a connector who can take care of this for them. But the first thing, always report any changes and submit documentation immediately. And then the state is able to work through and get your coverage reinstated. Next slide. And connectors can also help with that. So switching gears to the marketplace side of things. Now, there were a couple of changes that we've been talking about since last year with the One Big Beautiful Bill and the Marketplace Integrity Rule and the Notice of Benefits and Payment Parameters that we've kind of talked about in a bunch of different spaces. All of those different policies were aimed at including some additional rules around income verification for marketplace policy, for marketplace coverage. And there was a federal court hearing where there was an injunction that limited a lot of those rules that we've been talking about going into effect this year. It actually blocked them from going into effect. And so some of the additional income verification that we had talked about, some of the federal data matching issues and things like that we've sort of flagged over the last year, they're not going to be implemented. And so this open enrollment is going to be essentially much closer to last year than any other, or it's going to continue in that same vein. It'll be a sort of a normal open enrollment with a huge caveat because things are changing at the end of the year so significantly within Medicaid and Marketplace. But the APTC income requests for information, those are going back to a 150-day response period instead of the 90-day response. We've seen a lot of issues with people losing their coverage this year because of that shortened time span, but it's returning to 150 days at the end of this month and for the remainder of this year and next year. And the other big thing that I want to flag is that there's not going to be any changes to the basic APTC calculation methodology. And that's very technical, and I understand that, but part of the thing that the One Big Beautiful Bill changed last year is the way that that premium assistance is calculated, and that change on top of the expiration of the enhanced subsidies is why we saw such a huge price difference, a huge premium change between last year's marketplace plans and this year's marketplace plans. But there's not going to be any changes to that calculation. And so even if premiums do increase, now this year premium subsidies are going to increase to match that change for most enrollees. So most folks will not see an appreciable difference this year in the same way that they did last year. So that's a lot, but if you want to talk about that, I'm available. Like, next slide. All right, so with that in mind, this open enrollment is coming up very quickly. It's going to run November 1st through January 15th. December 15th is going to be the cutoff for January 1 coverage, as always. Kentucky is still going to maintain our traditional open enrollment window while the federal litigation continues. Plan certification is happening, open enrollment preps is happening. As a reminder, Passport by Molina will be exiting the marketplace as a QHP beginning January 1. But that doesn't impact any 2026 coverage, and Passport will still remain in Medicaid MCO. So don't get those confused. Molina is leaving the marketplace, but Passport is still going to be a Medicaid MCO. Okay, and then other for connectors and agents, training starts just in next week. The refresher course for agents is due September 18th, connectors end of October 31st, and there will be a new COLT learning management system. It's the Commonwealth Offerings of Learning and Training, new acronym alert, y'all, but that'll be launching soon as well. Next slide. Okay, and then some of the bigger policy things that we want to talk about. Some changes that are coming to Medicaid and Marketplace. We'll get into this a little bit more here in a minute, but non-citizen eligibility, that is changing within Medicaid October 1st. And then for Marketplace premium tax credits, that'll change January 1st. The work or community engagement requirements, we've talked a lot about this year. These are reporting requirements for certain Medicaid expansion adults. These members who will need to either demonstrate compliance or that they're exempt from these community engagement requirements in order to maintain their Medicaid beginning in January 2027. And folks who do not meet the requirement or don't qualify for an exemption are also ineligible for premium tax credits during that time. There will be more frequent renewals starting 2027 for adults. Medicaid expansion adults will move from 12 months to 6-month eligibility renewals. That'll begin for applicants in January 2027, but for current members, it'll start at their next renewal. So if somebody has their next renewal is currently scheduled for July 2027. They won't switch to 6 months until after their July 2027 renewal period. And then the retroactive period is also going to be shortened. So expansion adults will be limited to 1 month. Right now, it's currently up to 3 months before application. Expansion adults will be limited to 1 month, and other Medicaid groups will be limited to 2 months. Next slide. And so for non-citizen eligibility changing, that's the first one that's coming up. That's October 1. It means that folks who will full Medicaid coverage will generally be limited to U.S. citizens and nationals, lawful permanent residents, Cuban and Haitian entrants, Compact of Free Association migrants, and it's specifically in Kentucky, any lawfully residing pregnant women and children, regardless of their immigration, regardless of their immigration status, will still be able to get Medicaid in Kentucky. As a result, a lot of these other groups who are no longer going to be eligible for full federally funded Medicaid, including refugees, asylees, individuals on humanitarian parole, some Amerasians, and some folks who were granted conditional entry prior to April 1. So, and just as a note, that's happening within Medicaid, October 1, but for the marketplace, that is also those same eligibility changes will happen for the marketplace January 1. And there is not that same carve out for lawfully residing pregnant women and children for marketplace assistance. So there won't be any assistance available, but full price plans would still be available, which we know might not be affordable for most families and individuals. So very unfortunate. Next slide, please. Okay, our next MAC meeting. If you want to get involved, if you want to hear if you want to hear about all the things that are going on with Medicaid and our very own MAC chair, Dr. Sheila Schuster, just had a MAC meeting last week, I believe. The next one is October 1st, 10 to 12 p.m. If you're interested, the link is there. You can sign up for public comment. It's a great way to share your feedback and get involved and hear a little bit more from folks about what's happening within Medicaid. Next slide, please. And then if you'd like to keep up with the latest from DMS, Kentucky Medicaid hosts a monthly Medicaid forum on the 3rd Thursday of each month at 11 a.m. You can register here. The next meeting is August 20th at 11 a.m. And just as a reminder, so a lot of the changes that we're talking about the community engagement notices and all these Medicaid changes, DMS has put together a new website, and it's linked here as well. It's the DMS MACE website. We have big feelings about that acronym MACE, but it is where they're hosting all of this information. And at the beginning of July, the DMS sent out a notice to all households that have at least one Medicaid expansion member in the household. And they sent this notice that's linked here. It's also linked as well, just to let them know what's going on, what's changing, and when, and what to expect. So if you would like to see an example of that notice, it's also linked in there as well. And if you have just more information about wanting to track some of the policies that states are, as they're implementing all of these big changes, there's also a great tracker from Georgetown Center for Children and Families. Next slide, please. And then if you want to talk more about all of this Medicaid stuff, you want to get more into the healthcare policy, you want to talk more about some of these changes, or you have a story that you want to share, we have our Keep Kentucky Covered Coalition that meets the third Wednesday of each month. Our next meeting is next Wednesday. Lost the date, forgot to update it here. We'll drop that in the chat. If you're interested, reach out to Alex and she can help connect you to that meeting as well. Next slide. And then we also have office hours. If you have questions, technical assistance questions, cases that you want to talk about, specific questions, we have a lunchtime office hour drop-in that is the last Monday of each month from 12 to 1. You can register there to join us. It'll be August 31st. And then we have a new resource. We just redid our new website, kyvoicesforhealth.org. Previously, it was KY Loop where we hosted all of our resources. Well, now we've folded everything into one place, so it's even more convenient and better and organized. So all of our great explainers that we've linked throughout this presentation, they're filterable by topic, language, and audience. And any updated explainers will also always be posted there. So check it out. And with that, I will turn it over to Adrian. Thank you.
Thanks, Priscilla. Adrian Bush, Homeless and Housing Coalition of Kentucky. Good to be with you all today. All right, so the National Low-Income Housing Coalition of Kentucky releases a report on an annual basis called Out of Reach, and it attempts to quantify just how far out of reach housing is in each of the states and in different cities. And what we are finding across the country and in Kentucky is because of the lack of housing supply, particularly for our extremely low-income Kentuckians, rents are rising and homelessness is increasing. The average fair market rent for a two-bedroom home in Kentucky is now well over $1,000 a month, and the average housing wage is over $20. And what was most interesting to me with this report this year is that the second most expensive metro area is now the Clarksville metro area, which includes Hopkinsville, Christian County, and the counties there on the Tennessee border. Next slide. All right, so at the federal level, you may ask, what is Congress doing about it? And they are actually passing a law for the first time in over 10 years. We have the 21st Century Road to Housing Act. There's a lot of back and forth from the Senate to the House, back to the Senate to the House, et cetera, since 2025. We finally have a bill which the president let become law without his signature. The final bill is about 140 pages, and it incorporates different bills from about 60 different proposals that have been kicked around over the last 10 years. So a lot of consensus building was done. Next slide. All right, so there are some highlights in here. This is a good bill. Will it totally solve the housing crisis tomorrow? No, it will not, but it will provide some momentum because the federal government does have a role to play in housing affordability. One of the important pieces of it is reforms to the Rural Housing Services Department at the U.S. Department of Agriculture. Also, the Choice and Affordable Housing Act, which streamlines inspection processes for housing choice voucher holders. And then lastly, very important to Kentucky, we have the Reforming Disaster Recovery Act, which actually authorizes HUD's Community Development Block Grant Disaster Recovery Program for 3 years. Next slide. These are some of the other good things in this bill, in this law now, including a Whole Home Repairs Act, removing a HUD requirement that manufactured homes be constructed with a permanent chassis, also important to Kentucky. Next slide. We also have the Build Now Act, including bonuses for localities that improve their track record on increasing housing supply, and small community development block grant funding reductions for places that don't. We also have reform and reauthorization of the Home Investment Partnerships Program. And then lastly, their bill does maintain the language restricting institutional investors from buying, owning 350 plus single family homes, including an exception for build to rent homes and the establishment of a renter outreach resource at HUD. So that is, there's a lot to dig into the 21st Century Road to Housing Act. I think it will have an impact, and we'll keep digging into it as we shift into implementation. Next slide. All right, briefly, the continuum of care, which funds, it's the backbone of many states and cities' homeless response systems. Just a brief update here. After litigation from prior notices of funding opportunities and withdrawals and back and forth, all 2026 project renewals in Kentucky are being renewed. In the meantime, HUD did issue a new notice of funding opportunity for fiscal year 26 with many of the same legal issues that FY25 had. Both the FY25, that NOFA was found, was vacated at the end of June, and then the FY26 NOFA, which was under process during the application window, was open and due August 26th. That window, that NOFA has also been found illegal or has been vacated. HUD is maintaining its right to potentially appeal, but we will see. In the meantime, all of your stressed out homeless service provider friends can take a little bit of a sigh of relief as they no longer have an application that they didn't have full access to due in a matter of 2 weeks. Next slide. All right, so briefly, just revisiting the 3 pillars of state-based housing solutions. We need to increase housing supply and affordability. We need to improve access to housing for all and who are housing insecure, and we need to create statewide renter protections. Next slide. Couple of bills that passed. House Bill 333, Yes in God's Backyard. This is from the 2026 regular session. We also saw an appropriation to the $5 million to the State Affordable Housing Trust Fund. What is left to do in the 2027 session is dismissed eviction expungement, this year's House Bill 338, as well as Senate Bill 9, legislation to jumpstart residential construction through land use and permitting reform. Next slide. And one coda to the 2026 legislative session. Sorry. Senate Bill 197 was a line item veto from the governor. It converted $10 million from a residential housing infrastructure fund to just housing. And we found out via press release in the last couple of weeks that the governor has appropriated $2.5 million of that fund to higher ground communities in Eastern Kentucky that were developed in response to the 2022 floods. So, next slide. We've got some housing resources, such as they are for advocates and consumers. You're welcome to check those out when you receive the slide deck. And with that, I believe we will turn to wrap up very quickly.
Right. Sorry about that, y'all. We don't have any more time. So I just want to say thank you again for joining us this afternoon. There will be follow-up. We do have a few resources at the end of the slides. We always like to just make sure you have access to this information and it's easy to find, but along with our contact information. But you will be getting a follow-up email. You'll be getting the slides, the recording, the evaluation, and any of the links that we dropped in the chat today. So thank you all. I hope to see you in Bowling Green or Paducah or Covington later this year and on our next forum with the Cabinet for Health and Family Services. Have a great afternoon.